Welcome to eMedFX. With this quick tutorial, we're just going to be showing you the functions of the treatment by condition database. In order to enter the treatment by condition database, simply click this button here, and this will launch eMedFX's treatment by condition database. This database is just as the name states. It allows you to search specific treatments for a given condition. Let's say, for example, this patient presented with low back pain, which you determined is being precipitated by osteoarthritis and let's say some DJD. Clicking the search button will yield results that let you know various treatment options that have been published in the literature to show and been shown to be effective for treating lower back pain due to osteoarthritis and DJD. These are generally alternative treatment methods, and if you look down below you can see, for example, omega-3 fish oil at 3 to 6 grams per day. There are several studies that have shown that using omega-3 dietary fatty acids may reduce the discomfort associated with degenerative disc or degenerative joint disease rather. Also, if you go to lower back pain, it shows that cryotherapy or ice has been shown to be effective. This intended action field will show you the excerpt to the literature on this given study, ultimately what the study found, and then if you click over here it'll show you the reference to the study. So cryotherapy, exercise therapy for lower back pain, flexion distraction manipulation, heat therapy, ice therapy, interferential. Now you may be looking at this and saying, well, I know all of this. Clearly I know all of this. I'm a doc. I know how to treat these conditions. You definitely know this, and you're probably already treating patients with these modalities. However, if you're looking for referrals from other healthcare practitioners, let's say, for example, the medical doctor that's down the street from you, the medical doctor may not know that you're aware of this, or the medical doctor down the street may not be aware of this themselves. So rather than just being the person who treats this given condition with these therapies, you could quickly draft a note over to the medical doctor saying, hi, by the way, I'm treating one of your patients from DJD who has low back pain, and I'm using fish oil, I'm using some exercise therapy, flexion distraction manipulation, interferential current. We're going to throw some vitamin D in there, some B complex vitamins, and curcumin. Now you could list anything you wanted to here, and you can see that eMedFX returns references to the literature that have stated that, for example, if we look here, osteoarthritis, curcumin may be effective at treating this condition. So all we're going to do once we've selected our treatment plan essentially is click the Export to Report button. And after you click Export to Report, eMedFX takes you to a HIPAA-compliant secure server. Here you're going to enter some very basic patient information. Mr. John Doe. You'll enter the patient's date of birth here and enter the condition that we're treating, which is lower back pain. You'll enter the doctor's name in this field. In your subscription, your doctor's name will already be pre-populated, so Dr. Palmer. And then you simply click Export to Report. At this point, eMedFX is drafting a report customized to this patient with the information that it just analyzed. In eMedFX, we will populate your practice logo here, as well as your practice information. We'll title this report Condition Treatment Report. The patient's name will be pulled over to the report. The date of birth will be pulled over to the report. And then you'll see we write up this quick, nice summary about what we're doing for this patient, why we're doing it, and how the literature supports it. Here's how this one reads, for example. John Doe is currently being evaluated and treated for low back pain. Research suggests that the below listed treatment strategies may be able to aid Mr. Doe with his lower back pain. In an effort to provide the best care possible, we have decided to implement these treatment options into Mr. Doe's care plan. Here are the options that you chose, or here's the condition that you chose. So DJD, we elected to recommend some omega-3 fish oil, and here's the reason why we elected to add the omega-3 fish oil. Lower back pain, we're going to use some exercise therapy. Here's the reason why we decided to use the exercise therapy for his lower back pain. And these write-ups over here, the intended actions, again, are specific excerpts from literature that was performed that showed that exercise therapy is beneficial for helping people with lower back pain, and so on and so forth. For lower back pain, we're also going to use some flexion distraction manipulation. For his lower back pain, we're also going to use some interferential current. And then for the osteoarthritis that we knew the patient had, we're going to recommend B vitamins because they may help reduce pain and stiffness associated with osteoarthritis. And last but not least, we recommended that this patient take some curcumin or turmeric. The effectiveness, safety, and cost comparison of curcuminoids suggests that they would make a good alternative to conventional medicines for a host of conditions, including osteoarthritis. The nice thing about this is you sign off with this with the patient, and then we would recommend you take a copy of this and you send it over to the patient's primary care provider. Here you see on the last page is a list of all of the references that are documenting and substantiating the reason for your treatment plan. Another really good utilization for this report that we recommend is, say you're having a difficult time getting reimbursed by a third-party payer, because this third-party payer is saying, well, the treatment that you're rendering does not show any evidence to help with the given condition. You can send the report and say, it is our experience and we found in the literature these studies stating that the therapy that I'm using is in fact documented to be beneficial with this given condition. From this screen, here you would just go ahead and save this into the patient's chart in your, if you're using electronic records, it's saved as a PDF file, or you can print it out and save it if you have paper files. So that's the function of the treatment by condition database. We hope you like it, and we hope you check out some of our other databases as well. If you're interested, click the button above, and you can subscribe to eMedFX. You'll find it right here on our website's homepage. Subscribe to eMedFX. We have a couple of different subscription options for you. You can subscribe either monthly or annually. Thanks for watching the video. We appreciate it.